Hello, I am Dr. Sreenivasa Murthy T M, an ENT consultant at Columbia Asia Referral Hospital, Yeshwanthpur and Sreenivasa ENT Center at Yeshwanthpur. Anybody who has sinusitis will have nasal congestion. When I say congestion, that means nose block, some pain, running nose, discharge, headache. Sometimes they will have what we call as a post nasal drip. That means from secretions from the nose will start dripping into your throat, irritating your throat, can cause secondary sore throat, cough. And if these do not abate or they do not come down, the symptoms do not come down with regular home remedies, paracetamol, your antihistamines like or cetirizine, steam inhalation, saline water garglings, betadine garglings, then obviously we have to rule out whether this is a bacterial infection. Now, if it is a bacterial infection, you do need an appropriate antibiotic to be given for the appropriate dose and for the appropriate duration. Now, generally, sinus infections which are bacterial in origin require anywhere between 7 to 14 days of antibiotic therapy for complete resolution of the infection. Now, until this infection abates completely, you will have some symptoms persisting. Similarly, cough. Now, cough is reflex. That means it's a protective reflex given by nature or God for us to prevent irritation into the lower airway. So, it tends to cough it out. Whatever is irritating, it tries to cough it out. Now, until the primary cause is taken care of, cough will surely not come down. And as would be the experience with the majority of people who are watching this, from your own experience, you will be able to decipher that when you have an upper respiratory tract infection, of all the symptoms, namely sore throat, pain, fever, running nose, headache, the last thing that actually goes will be the cough. Everything else will settle down, but you will still be lingering with some cough for some time, and then the last thing to actually go is cough. So, if somebody is looking for an immediate cure, immediate relief from sinus infections and cough which have been there for more than a week, that would be a little bit not realistic. It may not happen with the best of medication. Generally, we would require at least 48 to 72 hours to know there is any improvement. And generally, that's the duration of time that one gets or needs for most of his symptoms to come down. So, I think 3 days of medication is what recommended before we can change it.